Hi there. I come to you today to talk about an important issue regarding healthcare reform. Today's healthcare issues surround one main problem: the fragmentation of our healthcare systems. In the recent Affordable Care Act created by Obama administration, a cure has been uncovered. This cure is known as accountable care organizations. Accountable care organizations, more commonly referred to as ACOs, have been compared to the elusive unicorn. Everyone seems to know what it looks like, but no one has actually seen one. Since the idea was proposed, many people have questioned, what is an ACO? And how will this help me? In a nutshell, an accountable care organization is a network of doctors and hospitals that share responsibility for providing care to patients. The average Medicare beneficiary sees 2 physicians and 5 specialists each year. This equates to 7 separate decision makers for the average patient, which can spoil their overall health care. Under the new law, an ACO agrees to manage all the healthcare needs for a minimum of 5,000 Medicare beneficiaries over a period of at least 3 years. This would resolve the problem we have today that patients are getting each segment of their healthcare needs separately. The goal of an ACO is to establish a system that will allow healthcare decisions to be made through a unified decision-making process rather than have multiple decision-makers advise patients separately. Solving this issue of fragmentation within the healthcare system is guaranteed to show positive results for patients as well as healthcare providers, and is best solved through more extensive provisions being included within the ACO model, which currently only takes up 7 pages of the massive new healthcare law. Let's talk more about the background of the problem. The issues of fragmentation are usually not recognized by a patient until he/she receives numerous bills and contradictory healthcare advice from several different types of doctors. Since patients are receiving their healthcare from numerous places, patients are left to coordinate all their physicians and billing by himself or herself, which often results in that patient not always receiving timely care best suited for their needs. At the illness level, Institute of Medicine studies show that, within any given hospital, many medical errors result because of a lack of effective data sharing and teamwork among the healthcare professionals working at that hospital. Studies indicate these errors are a systemic problem caused by hospital structure, rather than a reflection of rogue behavior by particular hospitals or individuals, and thus directly supports greater integration within hospitals as a way of improving healthcare. I have a few recommendations for action. First of and most importantly, we need to create a more in-depth and extensive provision in regards to ACOs. This topic needs to be a bigger part of healthcare reform as a whole, considering all sides agree that it can be effective. Also, I believe the program should be expanded by the Secretary of Health and Human Services so that it has a better chance of going into effect. I believe healthcare reform advocates should work with Department of Justice to expedite antitrust review and solve legal issues to integrated care. Lastly, we need to educate the people of the United States on the benefits of the ACO model so they do not reject the idea solely based on lack of information and political banter. With any new policy comes a wide array of questions, concerns, and the obvious political skepticism. Hospitals, doctors, and other individuals involved with the healthcare industry have raised concerns that ACOs could infringe on antitrust and anti-fraud laws, which are in place to limit market power that drives up prices and stifles competition. A major concern is that ACOs, more specifically ones present in rural areas, could grow so large that they would employ a majority of the providers in the region, therefore becoming a healthcare monopoly. In response to these concerns, the U.S. Department of Justice Antitrust Division has promised to provide an expedited antitrust review process for these new partnerships between doctors and hospitals. The extensive implementation of ACOs will help fix fragmentation of the U.S. healthcare system by encouraging shared decision-making, providing a centralized payment system, and coordinating care. It will improve care by encouraging a greater patient and caregiver experience. It will allow for patients to receive more timely care, appointments, and information. ACOs will improve communication between multiple doctors, allowing treating physicians to be on the same page when it comes time to making medical decisions for a patient. An ACO will have the ability to collaborate and coordinate care, clinical integration, ability to manage care, aligned incentives, and IT infrastructure. In conclusion, fragmentation is a huge concern today, and the expansion of the ACO model will greatly enhance the healthcare system for all.